my practice is very boutiquish, but the physicians in my practice, we treat all realms of health issues. And we focus more on the whole patient. We're not kind of focused on that disease state. We do clinical medical care, and so we try and improve their illness, but we also are functioning on their functional abilities, their abilities to get back to doing the things that they love in life, getting back to their families, so on and so forth. So I think it's a little bit different. We do have that clinical aspect, but we have that holistic approach as well.
Function is something that from the acute musculoskeletal sports injury, work injury, to the quite chronic and lifetime concerns, the impairments of spinal cord injury or brain injury, function really underlies all of that. So my world has to do with acute and subacute musculoskeletal injuries. So if I see somebody with an acute ruptured disc from work or from sports or from whatever, auto accident, there's other things too. Pain and nerve damage or whatever it might be, weakness. And somebody on the other end of the spectrum, at the far end of the chronic rehabilitation spectrum, it's certainly not a ruptured disc, and pain often isn't necessarily the primary concern, but function then becomes, again, for them, a big part of what we do.
That's one of the commonalities of physiatrists, that they try to work on helping people regain their physical functioning. The thing that attracted me to physiatry is my like or love for mechanics, biomechanics to be precise. So I liked to understand more about how things move, and when things go bad, how can you fix things so they can go back to moving as normally as they could.
I will never forget this patient. He actually came into the office, and very nice, average-looking man, standing up. His daughter, his 20-year-old daughter was in the room with him. The entire time I'm talking to him, he's telling me about his back pain, standing and pacing the whole time, which is not unusual because a lot of people with back pain have a hard time sitting. And one of the questions I asked him as a physiatrist was, how are you most functionally limited? And he kind of paused, and his daughter immediately jumped in and says, my dad hasn't sat since I've been born. And I kind of looked over at her thinking, that's impossible. How can someone not sit for 20 years? Because his daughter was at least in her early 20s. And he kind of looks over and he's like, I haven't been able to sit since I was 20, or since I was in my 20s. So what happened was he, in his early 20s, had a fairly large disc herniation. And when you have disc herniation, sometimes sitting can be in an uncomfortable position. And so at that time, a physician had told him, sitting can increase pressure in the disc, and that's why things can be painful when you sit. And so he internalized that for the last 20 years as, I can't sit. There is nothing in medical school that teaches you how to treat this patient. Someone who becomes so fearful of sitting because they're afraid they're going to herniate their disc again, it's hard to undo that, especially 20 years of that. Fellowship for me was just an incredible experience because I got to see this other side of medicine, of how you treat people's whole body experience and not just their physical pain.
Function interfaces with how you interact with the world. So somebody who is just not able to function like they were once used to, even if it's temporarily, it's a big deal for them.
One of the leading characteristics of a physiatrist is they know that it's more than science. They know that in order to get someone better, it's not just about anatomy, it's not just about lab values, it's not about anatomic correction, it's not even about biomechanical correction, it's about how you treat the whole person and looking at that person coming into your office as a person rather than a disease entity.
A physiatrist in general focuses on getting people functional again, getting them back to the life that they want, work-wise, social-wise, activity-wise. So I'm fulfilled when they are able to get back to doing what they weren't able to do as a result of their injury or disability.